I'm going to introduce you to our next speaker, is Professor Louise Signal from she's Director of the Health Promotion and Policy Research Unit at Department of Public Health, and she's a social scientist, so Public Health in Wellington. So her research focuses on identifying and addressing environmental determinants of health with a strong focus on equity for Māori, Pacific and low income communities. And a lot of her research is investigating innovative projects around the world that children live in with the kids' cameras. So I'm sure you'll find this presentation really exciting. Thank you.
Kia ora koutou. Is that all right there? Yeah. Kia ora koutou. Thanks very much for the invitation to speak today. I'm delighted to be here, and congratulations on 20 years of the EDOR Centre. It's been a great pleasure to be one of the team, if not a little remote, up in Wellington. I'm going to talk to you today about the obesogenic environment that we live in this country. So quite the other side, really, of Dave's really fascinating presentation, talking about the obesogenic environment of Aotearoa through the eyes of a child. And it's really 10 years now since we did the pilot study for this piece of work. We were funded by the HRC to look at how much junk food marketing children encountered in their day-to-day lives, and we developed a study called KidsCam. But we realised as we were doing the pilot that if we had permission from our very permissive ethics committee to study the world in which children live, we could do much more than just study their junk food marketing exposure. So the study was a camera study, which in the end then was an objective study of the world in which children live. We had 168 12-year-olds in the Wellington region, so primary school last year, year 8s. They wore a body camera and GPS devices for 4 days for us. They were astoundingly good researchers. They captured images every 7 seconds of the world in front of them, so you had a virtual video of their lives. We got 1.9 million images. We got about over 2 million GPS points as well. We've done 14 different studies as a result, rather than the one that we were originally funded for. And I think some of them were done on, University of Otago money, lotteries money, and so on. And of course, some marvellous PhDs and masters along the way. And we've produced over 30 papers, and we've still got more coming. So there's an example of one of our wonderful researchers with the camera around his neck and the GPS device hanging down below. So I'm just going to show you some photographs from the children to give you some idea of the obesogenic environment in which they live. So again, let's go back to the original study, junk food marketing. So this is a picture that a child took from their camera on their way to school. And if you think what they found was that they saw 68 junk food ads a day, more than twice as many healthy food ads. And I'm just wondering what brands you can see in that picture. Anybody? Coca-Cola? Yep. Cadbury is not there, and Tip Top. They're the 3 top brands that our children see. Coca-Cola, Cadbury and Tip Top. So this is a picture from a school. And some of you have seen it before, but it is rather riveting, isn't it? And so the kids see a lot of signs, they see a lot of print media, they see merchandise, but mostly they see product packaging in the space of the food area. So the Coke bottle, the chippy packet when they're eating their lunch, or their friends eating their lunch. We asked the children if they were Prime Minister for a day, would they do anything about junk food marketing? And 62% said yes, indeed they would. And somebody said, I'd get rid of all those signs we're forced to see. And somebody else said, I'd tell the truth. So I thought, well, we probably just ask the children and we'll get the answers we're looking for. And then just to prove the merchandising point, here is a child as a walking billboard for global corporate junk food companies. So then in adding other studies, I was really privileged to work with Christina McKercher, who some of you will know, who did her PhD looking at the availability of food in the children's environments. And she counted all of the lollies in a dairy, in a convenience store. She found that there is 10 times as much junk food in a dairy as there is healthy food, that it's mostly within arm's reach, that it's relatively cheap, that when kids purchase it, 94% of the time it's junk food that they purchase, and those are usually lollies and sugary drinks and ice cream. So there's just a picture of her, one of the pictures, and you can see the prices there are pretty cheap. And of course they do, bundle up stuff very kindly there in those lolly bags for the kids for $1. Nice to see the All Blacks in there. And this is work by Maura Smith, who's a dentist by training and has done been a major player in working on these projects with me. She looked at the drinks that kids encounter, and again, you see those kind of walls of fizzy drinks. And I don't know if you can see, but the hand is reaching out to push the Schweppes raspberry self-dispenser in that other picture there. Children were seeing or had available to them about 6 sugary drinks a day. And the majority had at least 1 sugary drink consumed every day. We were also interested in screen use and, of course, how that displaces physical activity. And we found that a third of the children were on screens in their leisure time, and after 8 o'clock, half of the children were on screens. So this is a piece of work by Belinda Lowe, which was called Watching the Watchers. So we watched them watch things. Another thing that was really important to us was our understanding of how poverty underpins so much of our obesity epidemic in Aotearoa, about hungry, food insecure children. And we were lucky to publish this paper, which is a compilation paper really of looking at a whole range of ways that we could study poverty by comparing the richest children, the least deprived, with the most deprived in our study. And so we were able to publish this paper called Children's Perspectives on the Wicked Problem of Child Poverty. And I'm just going to focus in on the food images here, but this is work led by Ryan Gage, who is, if anybody remembers, was a nutrition student here in Otago, and incredibly well trained, I have to say. So this is a life of poverty in a land of plenty. Fridges in high deprivation households had 78% less healthy products and 16% less unhealthy products. They just had less food. And then high deprivation children were 69% less likely to consume a nutritious meal on a school night. And high deprivation children had 64% less types of vegetables and 43% less types of fruit in their home. So in the absence of a child nutrition survey, that's a small start on thinking about the very challenging problem that we just are not facing here in this country. Kids Cam was good. It had some real strengths being objective. We had the spatial analysis. We had really rich data, as you could see, but it was only cross-sectional. And we didn't capture screen-based exposures, what's actually going on in the online world. And so we're now doing a study called Kids Online Aotearoa, and that aims to determine the nature and extent of children's online exposure and their engagement with it, and its impact on their health and well-being. And I'm a social scientist, so I'm a generalist in the public health space, so I'm really interested in regulating the online space. I guess that's my motivation here. We have to do something about this, I think. At the moment, we've had 90 children participate in our study from 13 schools in the Wellington region, and thanks to Rachel, I'm pretty optimistic I'll get to the 180 I now want to complete, to give us some power in the study. They're again the same age group, and they've used Zoom video conferencing, and they just record a meeting with themselves in the University of Otago cloud. So they just push, record like you do when if you're in a meeting, and we collect up to 4 days of online data from them. So you've got the actual real-time feed on their screens that's getting recorded to the screen, also the sound that's on there, and some of them also give us their surround sound as well. So you've literally got what they are experiencing and seeing online. One of the analyses we're looking at is junk food marketing online, and working with Jeremiah Deng in information science, trying to do some AI work there. So the children paint a clear picture of the action that is urgently needed. I think we need, and we'll be able to tell Shane Retty this now, because if you haven't heard, he is our new Minister of Health, that we need not education, as he's suggesting, but a comprehensive package that includes effective government regulation of junk food marketing and real sanctions, buyout of industry sponsorship of sport. We need to require, and this may sound radical, but plain packaging. That is going to be one of the important things that we need to do. It certainly was significant in the tobacco fight. We need to require schools, and of course we had that in 2008 before they took the HEHA program out, this healthy school food, and councils as well to provide healthy food environments. We need to introduce sugary drinks taxes and other food taxes. Perhaps we'll convince this Conservative government to do that, given that the UK's Conservative government put in sugary drinks taxes, and take the lead from places like Tonga, where they have incredibly world-leading work here in the area of taxes. We need to stand up to the food industry and remove them from policy making. We need to end child poverty and child hunger and stop food insecurity. And we need to protect children from harmful product marketing and sales online. I think our research really demonstrates all of these points. This is what the children are telling us about what it's like to live in our obesogenic environment. And so what I find interesting is that we know what to do, and it is hard after 10 years, and I too am getting closer to retirement than I would like, to feel that you are constantly thinking in more and more clever ways to prove the blindingly obvious to people who don't wish to see. And I feel we may well be in a climate of particular blindness for the next 3 years. And I ask myself, well, so if we know what to do, and I do think that we know what to do has got way ahead of what we are doing. It's kind of, I don't know if Jim will have experienced that, Rachel and others, but I think over my career, the gap has just really become a chasm, you know, between what we're doing and what we know we should do. And also, we've just done some recent research on the public's attitudes towards food regulation and food policy. And overwhelmingly, the majority of New Zealanders are either happy to have reform, they want to see junk food marketing out of the communities, they want to see our children food secure, and they want to see industry out of policy making in this space. Or at least they're neutral on the subject. And certainly the support far outweighs that of the detractors. So why don't we get that? Why don't we get the government leadership that we need? Why don't we get the societal leadership that we need? And I think this paper, I really commend it to you. It's led by Sharon Friel on the commercial determinants of health. And they're arguing in a very sophisticated and nuanced way around the need for reform of governance to promote health and equity ahead of the profits of multinational junk food corporations. So I think we need to have a new way of government, but we also need to ask the children, and I think one of the things that we found with our study is that whenever we talk about our work, the adults don't argue with us. I've been on Mike Hosking and he never took me to task, you know. That's a test, you know. So ask the children, and lastly, focus on human rights. And this is again another paper by Christina McKercher on rights-based approaches. Not only a treaty-based approach, which is utterly critical given the inequity we have in obesity in New Zealand, but also we need a child rights. We must protect the children. And we need a right to health. We are all entitled to live a healthy life at a healthy weight. And so that in the end we are focusing on human rights, not the rights of multinational food industry corporations to make a profit off our children and off us. As Dame Fiona Cooper said, take care of the children, for how the children grow, so will be the shape of Aotearoa. Kia ora, thank you.